So today we will be discussing one important topic, that is treatment of malaria. This is one of the most simple topic, yet it is confused in the clinical practice. So we will be discussing it mostly in the context of the clinical practice. So it is one of the most commonly encountered disease in the clinical practice, and the patient usually presents as malaria suspect, having symptoms of malaria, and then we send for the investigation. So the gold standard of investigation is doing a peripheral blood smear. Meanwhile, when you send for this investigation, you should start the patient with chloroquine plus primaquine. PQ is primaquine, 1 dose. So after this, when the results are obtained, 3 cases arise. First case is that either the patient has vivax malaria. So if the patient has got vivax malaria, and we know that vivax malaria is chloroquine sensitive, so we continue with chloroquine for 3 days. Along with it, vivax, it has got hypnozoids. So to eliminate these hypnozoids or the sleeping forms which are responsible for relapse, we give the drug that is primaquine for 14 days. Then the second case is if the peripheral blood smear comes out to be falciparum positive. So if it is falciparum positive, then what is the treatment? We know that falciparum is chloroquine resistant. So as it is chloroquine resistant, we now have to shift the treatment to ACT. So what is ACT? ACT stand for artemisinin combination therapy. So it is the combination of any artemisinin plus a long-acting drug. Okay, so it can either be artesunate plus sulfadoxime pyrimethamine combination, or artesunate plus mefloquine, or artemether plus lumefantrine. Either of these 3 for 3 days. Then the next thing is the infection can be a mixed type of infection, that is both Plasmodium vivax and Plasmodium falciparum positive. So in this infection, that is mixed infection, the treatment will be same as falciparum. But in this case, we need to remember that which ACT we should not give. The ACT, that is artesunate plus sulfadoxime pyrimethamine, should not be given. Why? because sulfadoxine pyrimethamine combination, it is not active against vivax malaria. Okay. Now what are the question asked? One question is asked repeatedly here, that why primaquine is given in Falciparum malaria. Primaquine in Falciparum. So the answer is, it is gametocidal. Next is, where this in northeastern states, which kind of ACT is given? The answer is artemether plus lumefantrine. It is given. So this is all about the uncomplicated malaria treatment. So whatever I have told is about uncomplicated malaria treatment according to the recent guidelines in a short form. Now coming to another thing, that is complicated malaria. So if, for example, there are certain complications, and for example there is cerebral malaria, the complications will be discussed in some other lecture. So what for now we will remember, we'll concentrate on the treatment part. So usually the complications, they are found usually in falciparum case. And if the malaria is complicated, then the preferred treatment is IV treatment, and IV artesunate is given. And what is the dose of this artesunate? It is 2.4 milligram per kg body weight at 0, 12 and 24 hours, and thereafter once daily. And in the meantime, if the patient becomes stable, then we can switch over this to oral artemisinin combination therapy. But we need to remember one thing, which artemisinin combination therapy is avoided when we shift to oral ACT in case of complicated malaria. So we need to avoid artesunate plus mefloquine is to be avoided if patient had cerebral malaria. Why this is avoided? Because mefloquine has neurotoxic side effects. Okay, so this was all about the treatment of malaria in a nutshell. So whenever a patient comes as a suspect, we need to send the investigation, and the gold standard of the investigation is peripheral blood smear. So meanwhile, we need to start the patient on chloroquine and primaquine. Now when the reports come, three cases arise. One, either it can be vivax malaria, that is chloroquine sensitive, so we'll continue the chloroquine for 3 days, and as because vivax has got hypnozoids, we need to give primaquine to prevent the relapse for 14 days. Next is falciparum malaria. Falciparum is usually chloroquine resistant now, so we give ACT, artemisinin combination therapy. So artemisinin plus a long acting drug is given, artesunate plus sulfadoxine-pyrimethamine or artesunate plus mefloquine and artemether plus lumefantrine for 3 days. Then the third case is when there will be mixed infection, that is Plasmodium vivax plus Plasmodium falciparum positive. In that case, it is same as Falciparum malaria, but one ACT should be avoided, that is artesunate plus sulfadoxine pyrimethamine should not be given, as this is not active against vivax malaria. Now coming to the complicated malaria, the treatment is usually IV and artesunate is given at a dose of 2.4 mg per kg. Then when the patient is stable, then we can shift it to the oral artesunate combination therapy. And which ACT should not be given if the patient has cerebral malaria, that is artesunate plus mefloquine should not be given, because mefloquine has neurotoxic side effects. So this is all about treatment of malaria in a nutshell. Thank you.